Conversations with Nicole. Conversations with Nicole. Let's talk about it. Tell me all about it. I'm here. I wanna know what's on your mind. Ooh, the world needs to hear from you, and I'm so glad to have a conversation to reach the nation. And it's all about you. We'll help each other to discover innovative ways to positively change the world. Let's talk about, let's talk about, yeah, let's talk about conversations with Nicole.
Greetings. Happy Wednesday. Welcome to Conversations with Nicole. I am Nicole Everett, your host. And Conversations with Nicole is a talk show based in Tallahassee, Florida, focused on connecting the community through conversations. And today is what I call Wellness Wednesday, which is an opportunity for you, me, and my guests to chat about whatever it is we want to chat about. And today we are talking about ADHD. Yes, ADHD. And the diagnosis of ADHD and why that is important. My very special guest comes to us from Chattanooga, Tennessee, Dr. Cassandra Simms, who is a psychiatrist. And so I am super excited and delighted to have her with us tonight. So y'all need to be here. Listen, those of you who are tuned in, tag a friend, please like, please share, let them know they need to be on here because this is going to be a great conversation. This is an interactive live, and we fully expect to hear from you. Your comments, your questions are welcome. We are live on YouTube. We are live on Facebook and as well as LinkedIn. So several ways to engage with us tonight. This is a safe space for us to communicate with one another. And we are definitely trying to encourage the elimination of stigma associated with mental health and mental illness, especially in Black and Brown communities. So I see a few of you all chiming in. For those of you who are new to the platform, I invite you to put your city and state in the comments so that we can give you a shout out. I see you, Ma, down in Miami. Thank you for being here. We got Austin Matthews. Dr. Simms is the best. Awesome. Thank you for being here, Austin. And Miss Janita, good evening, family. Thank you for being here. Appreciate you right here in Tallahassee Midway area. We got Marlene Mance down in Pembroke Pines. Thank you for joining us, Marlene. Appreciate you so much. So I know that we have a great representation from the Chattanooga, Tennessee area. I was introduced to Dr. Simms through my cousin, Pastor Ernest Reed, who is Dr. Simms' pastor. And so I'm pretty sure we're going to have some great engagement with our folks from there. So we welcome you to the platform. And again, we are excited about this conversation tonight. So I'm going to go ahead and share some of Dr. Simms' bio. She is a board certified adult and child adolescent psychiatrist by the American Board of Psychiatry and Neurology. Dr. Simms received her medical degree from the University of Kentucky in 1999. She completed her psychiatry residency and child adolescent fellowship at the University of South Carolina. In May of 2004, she moved to Chattanooga, where she worked with Focus Psychiatric Services, Inc. and Park Ridge Valley Hospital, treating children and adolescents in an outpatient and inpatient setting. In 2009, she became a faculty member with the University of Tennessee School of Medicine, briefly serving as an instructor for clinical education, in which medical students shadowed her for a portion of their psychiatry rotation. And from August of 2012 to August of 2015, she was employed by the community health system via Skyridge Medical Center in Cleveland, Tennessee. She provided inpatient care to adults at Pine Ridge Treatment Center. In August of 2015, she transitioned to her current outpatient private practice, comprehensive psychiatric care in Chattanooga. She offers supervision to nurse practitioners in the surrounding area. And in November 2020, she added to her current responsibilities the role of being the psychiatrist, for Embark Behavioral Health, a male short-term residency facility in Benton, Tennessee. So y'all help me welcome Dr. Cassandra Simms.
Hello, everybody.
Welcome. Thank you.
Thank you for having me. Thank you for having me.
My pleasure, my pleasure, my pleasure. So we got a lot of folks that have chimed in. I want to just acknowledge them briefly. My sister Bambi, Chevrolet, Maryland. We got Miss Jeanette down in Miami Gardens. Miss Glory Sellers in Brooklyn. Brooklyn in the house. Natasha Myers in Miami Gardens. Treva Sands, I've been waiting on this all day. Nice. All right. Chad is in the house. Thank you for being here, Miss Treva. Brent, Missy Matthews, Dr. Sims saves lives and families. Love it. All right. Very good. Mr. John White, who's in Jacksonville. Thank you for being here. Anonymous Legacy, her nephew and his girlfriend Jeremiah Ashley, Somerset, Kentucky. All right, very good. Thank you for joining us. We got Frank Kell here in Tallahassee. Thank you for being here, brother. And also Miss Pumpkin, who is here in Tallahassee as well. Wonderful. All right, so Dr. Sims, I want you to tell us, who is Dr. Cassandra Simms? Not what you do, because I read all of that, but who are you?
Well, I'm a wife of 23 years. Okay, I met my husband when I was at Transylvania University undergrad. I met him and in Lexington, Kentucky. We've been together for over 30 years, but we have been married 23 years. I'm a mother of two daughters. One's 20 and one's 13, just turned 13 a few days ago. And those are my pride and joy. My family is my priority. God has blessed me definitely with a supportive family and loving family that helps me kind of continue to have the strength to do what I do.
Nice.
God definitely placed me in the position that I'm in through my career. I didn't know about psychiatry when I started psychiatry. There was a young lady that I encountered during my program, and she kind of kept coming into my life through different areas of my training, and psychiatry was a big part of her life. And so that's when I learned about child psychiatry, and I've been doing it ever since. So.
Nice. And so, when we talked, I told you that black counselors and therapists are gems. And I say gems because you all are few and far in between. But black psychiatrists, y'all are like unicorns because there's not a whole lot of you out there. I probably can count on one hand how many black psychiatrists that I've had on the show. So, if you don't mind, for those who may not know what the difference is between a psychologist and a psychiatrist,
That's good.
You could share that. Yeah.
So the psychiatrists go a different route. So they tend to go the MD route. So they do undergrad just like us, when it goes in psychology, but they do medical schools. They do 4 years of medical school, and then they do training on the medical track of psychiatry. Whereas the PhDs, they do undergrad, but then they go the doctoral route, where they do graduate school and then kind of go on and get their doctorate. When they kind of get finished, the MDs, we tend to focus more on medication management, but the PhDs tend to focus on therapy, but they also are trained to do psychological testing. So a lot of their testing and working with them together, we use their testing to confirm what we see clinically as far as diagnoses are concerned. So that's how we put it together to kind of all rounded give the person, the continuity of care.
Indeed, indeed. Continuity of care. Love it. All right. So before we get started, I want to share my disclaimer because I don't want anybody to mistake this for counseling. And that is that all topics, past, present, and future, on Conversations with Nicole are for informational purposes only. They are not to be used as a diagnosis for treatment or an answer to any personal issue related to the topic being discussed before, during, or after the program. All right, so we are talking ADHD. I think a great place for us to start would be by defining what ADHD is, and then why is the ADHD diagnosis important?
Okay. Well, ADHD, most people know it's attention deficit hyperactivity disorder. Okay.
Mhm.
And there's three types. There's the inattentive type, hyperactive, impulsive type, and the combined type. Okay. The inattentive one is where they'll say, I don't not ADHD, I have ADD. Okay. So that's just where there's an
Mm.
attention piece of it, but the hyperactive, impulsive piece is not there. And that alone kind of speaks the stigma of ADHD. But so you have those three types. And the biological piece behind it is that there is a chemical imbalance. So it's related to neurotransmitters that we call norepinephrine, which is linked to dopamine, which are linked to our excitatory areas of our brain. That's our reward center. That's our pleasure center. Okay. And
Mhm.
so it's difficult for them to find pleasure in things because they're somewhat depleted. They don't make as much as everybody else. And so
Gotcha.
with that, there's extra energy and effort to kind of things that are boring, okay, for them to have to kind of apply themselves. And so
Hmm.
that's when it affects attention, impulsivity, hyperactivity. You get those symptoms associated with ADHD, which can impair your functioning academically, socially, and even when you kind of later financially, as far as job placement, stuff like that. So, depending on how early it's diagnosed, can affect you later on life if not appropriately treated.
Okay. So, but we often hear of ADHD as it relates to children, correct?
Yes. So most commonly you get in children. Okay. That's when it should be noticed. Okay. And everyone asks, when am I going to grow out of it? Some people grow out of it, some people don't. Okay. Um,
Mm.
about 20% of people won't grow out of it. They'll still have symptoms. But I think that also depends as an adult of what you choose as your profession. So if you're one that has ADHD and you do stuff that is with your hands outside, that stuff that's going to keep your attention, you may be fine in that type of employment because it gravitates to your strengths. So it's making sure you kind of go towards your strengths to kind of help you fulfill success. So if you're hyper impulsive, we don't need to sit down at the desk job, okay? Because that's going to be boring. It's going to be hard for you to manage that.
Hmm.
So it's also knowing yourself and learning yourself through the years with it and what it affects, so that you can gravitate as an adult to what could possibly be the direction you need to go. Um, so with that, so you do mostly want it diagnosed in kids, okay? However, there's those, I call them la la landers. Those are the ones that kind of not hyper impulsive, but they're our daydreamers. Okay. Those
Okay.
get missed because when people think of ADHD, they tend to think of the hyper ones and the ones kind of loud in class that are maybe more disruptive. Where our quiet ones, they're there, but they're like just there, right? And it looks like they're paying attention, but they're not because they're not disrupting class. And so they're the ones that the story usually goes, I'm looking at you, but I'm not registering what you're saying. Okay. So it's like I'm appearing to be listening to you, but I'm really not. And those are ones you'll have to repeat instructions repeatedly because they're not following them well, because they're getting bits and pieces of what you get versus not. They may miss part of class because they're kind of thinking about what I'm going to eat when I go home. And so those type of things. So those are the quiet ones, and those get missed a lot. And so those are the ones that you also need to worry about as they progress because they get missed. And then when things get fast in middle school, that's when they tend to kind of have more symptoms that come along with it.
Wow. So, if you so many questions. So a parent, they may be noticing that their child is a la la lander or that is hyperactive. Um, would you recommend that they get their child tested, or what would
Usually, how it comes to the teacher usually kind of brings it to the parents' attention that they're having difficulty. So
you? Hmm.
that's kind of one part of the criteria is that you see the symptoms in two areas of life, and that's usually school and home. Okay, so The teacher usually brings it to the parent's attention, and then the parent, most usually, if they're in agreement, will take them to their pediatrician. The pediatrician is usually their first line of defense, kind of.
Mm.
So the pediatrician gets the individual, and there are questionnaires that the can be provided to the parents
Mhm.
um, and the teachers that kind of, depending on the scoring, can give you solidify the diagnosis. But there's
Mhm.
also some that you can go to a psychologist and get that are computer based that also can solidify that diagnosis. So
Okay.
if the pediatrician does the questionnaire, it depends on their comfort level of whether they want to prescribe or not, or refer to a psychiatrist. It kind of depends on their comfort level. And then from there, but the parent may not be comfortable with medication at that point. So there are some therapists that do behavioral therapy, so to speak, to kind of help them learn ways to help cope with ADHD. It just kind of depends on the severity at that point when they get that first assessment.
Gotcha. So Gina Wilson is joining us. She said there are so many myths about this disorder. I hope to gain some clarity. And she further had a question. She says, so many pastors recommend discipline. Can this be dealt with without medication?
Well, that's the kind of the stigma, right? So ADHDers tend to get the I'm the bad kid of the class, okay?
Mhm.
Because if you have a kid that is hyper, they talk too much, they're interrupting when the teacher's talking, they may be a little more intrusive with their friends. They're the ones that the teacher's having to call out the most, okay?
Mhm.
And so with that, you tend to get they get negative attention, okay, but then it's still attention. And so those are things, they're not acting out to be bad. There are some things that they can't help in that classroom, because when they're put in a situation where they have to sustain mental effort, it's a very uncomfortable situation for them. Okay.
Mhm.
Now, since they're getting corrected, yes, you're going to get behavior, because a common diagnosis that comes with ADHD is what we talked about, oppositional defiant disorder. Okay.
Mhm.
Well, if I'm impulsive and I can't stop and think what I'm doing, it's going to look like I'm defiant all the time.
Mhm.
And so you get that kind of those two diagnoses, but people tend to tag the ODD, the oppositional piece of it, more than the
Mhm.
ADHD piece. And then it looks like it's a behavioral issue and not just a um, psychological issue. And so then people want to tag, especially in the African American community, tag it as a bad kid, okay, and not treat what it is. And so then when you get behaviors, if I can't focus in school and if I don't understand it, and it makes me uncomfortable. When an individual is uncomfortable, their behaviors are so that they're going to do behaviors to get them out of what's uncomfortable.
Mhm.
So if they act out and school suspend, what did they just reinforce? They reinforce that if I act out, I get to go home, or I get in school
Right.
suspension. I don't have to stay in that classroom, which makes me feel like I'm
Exactly.
not smart. And so then the behavioral stuff escalates because it gets me out of what I don't like, because we
Mhm.
falsely rewarded it. So yeah, discipline, but then we have forgot to treat the ADHD in the first place, and the
Yeah.
ODD became what they started to use to cope. Because if I'm
Mhm.
uncomfortable, I don't want to be here. So I'm gonna do, if it works and gets me home. So you got to hope that you start treating before that takes over, because then that becomes their way of coping. It's not everybody, but
Right.
if you miss it and you don't treat it and you say it's just behavior, then it's that child is getting labeled behavior. It's not the ADHD, it's the label, it's the behavior. But
Mhm.
it's behavior because we didn't act on it when we should have acted on it. And the behavior becomes the way of getting them out of what's uncomfortable.
Indeed. All right. So we
Discipline, yes, but then discipline, you got to also still be consistent and realize that they have the diagnosis and still be consistent as a parent. So just because they have ADHD doesn't mean we stop parenting. Okay.
Mhm.
Um, we still do the parenting, but just know that you may have to tell your kid 10 times rather than 2 times. Okay.
Right.
Don't get mad, because they're getting part of what you say, not all of it. So
Mhm.
they get the first part, but they may not get the end. So
Yeah.
you get mad because they're not doing everything you say, but they can't pay attention to the whole thing. It's not that they're ignoring you and being defiant. They're just not getting
Mhm.
all of it. So you, as long as you're okay repeating it, then make sure you give like one single task. Don't give them multitask. Okay.
Mhm.
Don't give them three things to do at one time. Give them one thing. So
Mhm.
then also recognize where your parenting is, so that that can adjust as well. If
Ooh,
that makes
so
sense.
that makes a whole lot of sense. Look, that's a whole nother show right there, because that I can just imagine how challenging that might be. We got Keezy on with us, who's here in Tallahassee. She's affirming what you're saying. We have Shelby Matthews, who's giving you some hands up, high fives. Michael Cork, he said, this is great information. Definitely the best explanation I've heard. Thank you so much, Cork, for being on with us. And then Miss Clotilde Simone, who is a clinician in the Central Florida area, she said, yes, she's on point. Exactly how they get misdiagnosed. And she said, preach. One task at a time. One task at a time. All right. Gina said, I can't help but think about this systematic misdiagnosis and how this has affected our community. Exactly.
Yeah.
Yes. Yes. Yes.
I
Yes.
have a young lady. And when I first encountered her, she was struggling. She was being suspended. She was fighting. All those behavioral things were there. But on those days were the days where either she missed her medication. Okay. All right. And then, or the medicine, when it was adjusted, the behaviors went away. And so, but the school didn't want to recognize the ADHD because the behavior was so significant. But now, once we've stabilized her, she's a straight A student. And she has her blips, but when she has her blips, I know I need to adjust, right? So, and she's grown to understand it, and so she can recognize when I'm having a hard time, controlling my impulsivities, and so she can recognize, because now she's a high schooler, but she can recognize it more compared to when she was younger.
So that takes a level of self-awareness on her part as well.
Yeah.
Yeah. Wow. So on top of just growing up, as a young child into adolescence, into adulthood, this is another layer of, again, self-awareness that has to be taken into consideration.
Yes. And I, as a parent, we're all scared of the medication because it's medication. And so, but when you kind of see kids, when I get them later, like if I get them in middle school, and they've not been treated, but I get them at that time, they're anxious and depressed because in middle school, you got hormone changes. Okay. But also everything goes quicker. So all the homework you get, everything's faster and expectations are more. So with that, you have an ADD, ADHD kid that has not been treated, and so then put them in middle school. So what happens is anxiety goes up because things are going too fast. They start to feel incompetent. They start to feel, I hate the word stupid, but that's what kids will say. I feel like I don't belong. Social stuff increases because they have a hard time following conversations. So sometimes they'll be in a conversation and they'll feel left out because they're zoning out and they're not staying in the conversation. So it affects them socially. And then when those things continue to go untreated, depression can possibly pop in. So sometimes kids come to us anxious and depressed, and then we treat, but nothing gets better because as you ask more questions, we didn't go after the ADHD stuff, which kind of triggered it in the first place. Then you have self-esteem issues, and there's some other things that can be there. So it's just really listening to the kid and making sure that we recognize that the kids have adult emotions, and because if we don't get them now when they're adults, they have a hard time functioning. They have a hard time with job changes, finances, relationships, because that impulsivity wasn't maintained. And when I say maintained, I always describe it to parents as if I put them on meds, the hope is that they gain the skills while they're on meds. So as an adult, they have the skills. If they're going too fast in life and they can't actually take in what they need to take in to function, they can't learn what they need for life. And so medicine helps them be able to be maintained because they're overstimulated and they don't know what to do with that stimulation. So it helps them be able to divide and conquer and understand rather than be lost. And if they're lost as an adult, nothing gets better. So you hope that you can train them as they go so that as an adult, those things are better. But it's making sure they understand the trail of things and how things can progress and understanding it so they know when things are overwhelming and when to apply skills and those type of things as you go through the process.
Whew, you said a whole lot. I'm gonna try to go back and circle back on some of that. But I do want to acknowledge my sister, my little sister Shayla, who is down in South Florida, we got Mr. Terry Parks, Dr. Terry Parks. It was a psychologist in Atlanta who will be on with us at the end of the month, being fresh. We got Brandon Holt. Dr. Sims is full of wisdom. I always benefit from learning from her training and experience. Thank you for joining
Hey,
us.
Brandon.
Brandon. All right. And Anitra Paul Moore, she said, Dr. Sims helped me tremendously with myself and my son when he was 4.
Yeah.
Yes. So Janita made a comment that I think also just kind of highlights this conversation is that it isn't just the misdiagnosed, but the undiagnosed, which is exactly what you were just talking about. So, what can be done, if you go through all, childhood and it's undiagnosed?
Mhm.
As an adult, like, and this is discovered, or are adults tested?
Yes,
How
yes.
does that, yeah, how does that work?
Yes, so adults can be tested just like the children can, and usually providers do insist on adults being tested just because adults there are drug seeking behaviors. So sometimes the substance use issues we have to kind of make sure that we test and we have the testing to solidify the diagnosis because of there are drug seekers out there, and that ADHD medicines, a lot of them, they are controlled substances and stimulants, so they can be misused if you're not properly diagnosed. So with that, adults can be tested the same way that kids can be tested, but it's usually done by the psychologist because by then you're out of school, and most of the symptoms at that time, the teachers you've learned to fake it to make it, so you're kind of in there. And so with that, teachers wouldn't recognize some of the symptoms that need to be recognized. So usually they go to a psychologist, have the testing, and it can be treated. And it's to kind of, compliance is a big issue, making sure they're being compliant. But at that point, they have maturity on their side. So you may be just kind of dealing more with inattentive issues rather than hyper impulsive issues. But they can be treated, tested and been treated as well
Mm-hmm.
with the same
Indeed.
medications. And so, and they're probably, I won't say they're not easier to treat, but the metabolism slows down as we become older.
Mm-hmm.
So whereas kids, the metabolism so fast, a lot of the medicines don't last them through the day.
Yeah.
And as adults, as our metabolism slows down, the medication tends to last longer as we become old.
Yeah, makes sense. Makes sense. All right, we got a few folks shouting you out. Madeline Free, learning from Dr. Sims is an honor. Thank you for being here, Madeline. Brooke, Dr. Sims is amazing. She cares so much for her patients and works countless hours for them. Thank you for being here, Brooke. We got LaCarsha Houston, who is a regular on CWN. I appreciate you being here, LaCarsha. And then Frank Kell said, thank you for the space. What type of reward system would you recommend for children of African descent who appear to display symptoms or are diagnosed with ADHD? I often see punishment, discipline, which I think Gina may have touched on a little bit earlier.
Mhm.
Mm-hmm.
Yes. So it's, yeah. So like the discipline piece, because I think that culture wise, that's kind of, how we,
Mhm.
are known to do.
Yep.
And so then but that can create more self-esteem issues in the long run. And in addition to that, it can create, when they're a parent, they may go the opposite way. So, and become too complacent with parenting. So, but rather than come in the middle. So, reward systems, gosh, it's ad nauseum of what you can use. So usually you want to make sure that you reward and give attention to the good, because if you're getting on them all the time, that's still attention. It's bad. So then you don't want to always pay attention to that. Make sure we pay attention to the smallest thing. So
Yeah.
there's beat system, money system, not money, fake money. Okay. So that if you have a system, like if they're supposed to, because you want to teach organization, you want to teach time management. These are you want to teach good social skills. So make sure, like when my daughter was younger, we had a list of tasks she had to do in the morning and a list of bedtime tasks she had to do at night. She
Mm.
learned so much, but it was like 4 tasks. It was, make your bed in the morning, brush your teeth, get your clothes on, turn off your lights, and come downstairs. And so with those, there were so many points to those if she did them in a timely manner, because you're teaching time management and
Mhm.
multitasking in a short amount of time. And
Mm.
that's the most difficult time for ADHDers, is in the morning and the evening. And so,
Really?
in the evening, it's the same thing. So it's make task completion, and then if they get so much task completion, it could be fake money, it could be a quarter, whatever. Just use your Monopoly money, and then that can kind of have like a gift box. If they earn
Mhm,
so much from that fake money, they can, get some Dollar Tree gifts and put it in
mhm,
there. They can buy
mhm,
stuff from that treasure box. In addition to that, you're teaching how to save money because maybe there's something in they want, but they didn't earn enough. So then you can teach saving to where let me save it, okay, so that I can maybe get that next week. Okay, so there's a lot of different things you can do to incorporate that and teach things that ADHD also have problems with. And so that's time management, organization. I always teach parents that we're not always clean. Okay. So go ahead and start early. Beds to be made every day, every night, pick up stuff on the floor.
mhm.
If you have one, I have a trick question for kids. I said, are you one that hangs up the towel or do you just dry off and drop? Okay.
Yeah.
Most of them say dry off and drop. The task is not
Mhm,
completed. We
mhm.
take it and we put it up, right? Okay. It didn't
Yes.
complete the task. And so they always laugh. And so I always had a punishment, so to speak. I call it the Karate Kid punishment because in the Karate Kid, he always had to.
Oh, uh-huh. Yeah, yeah, yeah.
So I was like, well, if you forget, we're going to do Karate Kid. You have to do it 10 times rather than one time.
Mhm, mhm.
But in that you're doing repetitiveness, so they actually remember the task. Okay.
Yeah.
So something like that. But
Good.
you're rewarding and if you ever see them do something that you didn't ask them to do, okay,
Mhm,
and they did it on their own, that whatever is fake money, whatever you use, that's doubled. Okay. Because then
mhm.
they are doing things on their own and you don't have to tell them, right?
Right.
And that's kind of where there's things that are expected and things that you want them to do on their own. And those
Mhm.
things on their own, you should kind of make sure you make a big deal of it.
Gotcha. No, these are really great tips. For those of you, we are a little bit of about halfway through our conversation, but for those of you who are just tuning in, I am on with Dr. Cassandra Simms, psychiatrist out of Chattanooga, Tennessee. We are talking about why is an ADHD diagnosis important. We talked about ooh, the a little bit about the three types, but also oppositional defiant disorder, um, some of the characteristics, especially in children, and then some of the things that you can teach the children to assist them with a reward system. I see Dr. Parks asked a question. He said, I'm late, but the question is ADHD reserved for children and ADD for adults?
Not necessarily,
Okay.
because I have some adults. They might not be hyper; that they're impulsive, but the
Mhm.
impulsivity looks different. So spending money, and it's not mania. Okay, spending money, relationships. Okay, making decisions quickly with relationships. Um, driving. I have, getting speeding tickets. Those are ways that it would come in an adult rather than, a kid bouncing off the walls.
Mhm.
However, in adults, you hope that maturity gets on your side so that that hyperactive impulsivity stuff can kind of be more managed and it would look more inattentive as
Okay.
the inattentive type.
All right. Dr. Parks is suggesting a joint program between you and him. We can talk about that. He also says token economy system works as well as a grab bag. Catch them doing good, which you
Yeah.
did
Yeah.
express. Anitra, both parents have to be on one accord also. That's a biggie. All
Yeah.
right.
So
Yes.
yeah, so if you have one parent not wanting meds and the other one, yeah, yes, that's and
Mhm.
if you don't have them, as far as the system that you're using to kind of reward, okay, if it's not the same, then
Mm.
it just defeats the whole process and it
Yeah.
becomes a conflict for the child.
Consistency is key. Ashlyn, giving you some claps. And Frank Hill said, thank you so much, Dr. Sims. I've learned to replace candy as a reward with fruit, promoting healthy behaviors and actions. Much appreciated.
Yep.
Yes.
Yeah.
So Frank Hill and I garden together at a community garden here in Tallahassee. And so we are all about the fresh produce.
Definitely, definitely.
Yes, 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 yes. All right. Janita said, I've been considering neurofeedback therapy. Are you familiar with this treatment approach? And if so, what are your thoughts of its efficacy?
Actually, yes. Brandon, who kind of said something earlier, okay. they I have known that it's been done in the community, but in working with Embark, it is definitely a way to that they've been using to compromise with the medication. Okay, and so I've seen great results with it as long as it's done consistent and you stay with it. You can't go hit or miss. Okay, you know, when doing it, you got to kind of do the amount of sessions that's recommended. But I have seen some definite good results from it if you're consistent with doing it as it's determined to be. It can be very helpful.
Okay, very good. Thank you for sharing that. All right, and Brittany has joined us. Thank you for being here, Brittany. So, wow. I'm kind of I got so many thoughts in my head about this whole thing. So, the parents, I want to kind of go back to them from the standpoint of, again, just parenting skills that may be necessary. I mean,
Mhm.
you gave a great example of the things that teach the children: organization, time management, multitasking. But maybe some parents may not have a clue that this is even going on. And so, any guidance or anything that you can, I mean, we talked about the testing piece, but any other tips or tidbits that you can give to them? Because I would imagine, especially if you have more than one child, you know, at least when I was coming up, parents kind of, you know, what I do with one child, I do with the other, I guess, in terms of, attempting to have some type of fairness, but each child is different.
Mhm.
And
Right, right,
so you kind of have to parent them different in some regards, right?
right.
And so, again, and I'm sure you deal with parents all the time. So, any guidance that you can give as it relates to that?
I think it's, because you don't, they don't have the criteria book to go down and check the list. Okay.
Right.
So when I even ask questions, I don't even ask it like that because that's not how the kid looks at it. So
Mm-hmm.
things that, if you notice kind of in the household, like I mentioned, the towel. Okay. If you notice you're having to repeat an instruction several times, and they get half of it or don't get it at all, make sure they repeat it to you, so that they know that they're listening, because there's that symptom of appears to be listening, but they're not listening. Okay. They're making eye contact, but they're just doing this. Okay. All
Yeah.
right. So I commonly will ask the kids, what did I say? And I catch them because they don't know what I said. So,
Mm,
so stuff like that. If they don't complete tasks that you ask them to do, if you give them three things to do and they only come back with the first or last one, that's probably a sign. Okay. If they're reading, when they're reading and they can't kind of tell you what they're reading about,
mm,
this is a huge one because a lot of kids will read the words but not comprehend. And then they're like, I don't even know what I just read. And they go back and they go back because they're losing concentration as they read. And
mm,
that is a common thing that I have them describe. I just ask them, how's your reading? And I don't give them any hints of what to say. But if you notice your child's really struggling with that, and it may not be ADD or ADHD, but
mhm.
it may be a sign that you might get them tested because there may be a comprehensive, problem going on that's not
Yeah.
ADHD, maybe something else, a learning disability that's there instead. But
Mhm.
uh, so if you feel like you're getting on your kid all the time and for the same thing, and you
Yeah.
want to pull your hair out because you're telling them the same thing every day, all day, um, look at what you're having to say to them, and is
Mhm.
it a task that's always not being completed? And if
Yeah.
so, step back and kind of look and see what's different and what could you possibly change, and
Mm,
then talk to your pediatrician because they have the questionnaires, and that would kind of be something to kind of put things in perspective, and not jump to it's a bad kid. Okay, all right. Not jump to boys will be boys. Okay,
mhm.
because that can cause some stuff later on. So, and that's the stigma, and the stigma is, well, they're going to be labeled to be bad. But if we don't treat,
Mhm.
they're going to be labeled that anyway. Okay. And so, and you increase your chance of, if you don't treat the hyperimpulsivity as an adult, you increase your chance of substance abuse. Usually everybody says, oh, if you treat them, you actually they're going to get addicted.
It's the gateway.
Right, right. When you don't, the impulsivity is not managed, so you increase the chance of them being impulsive in their decisions, which can
Mhm.
include substance use.
Yeah.
Um, so, so that's the kind of one of the things everybody thinks they're going to get stuck on it. When we don't treat, okay, later as an adult, they're going to find what their brain is missing. Okay,
Mhm.
um, And then remember, they're missing stuff that excites their brain. So they're going to
Yes.
find stuff to excite their brain. We wanted them to do it naturally. We wanted them to do it through exercise. We wanted them to do it through roller coasters, skateboarding, whatever it is, sports, because that's an adrenaline. I always call my ADHDers adrenaline junkies because adrenaline's a stimulant. So
Mhm.
the ADHD medicines are stimulants. So it stimulates in the focus. So they find through their behavior how to stimulate that area of the brain. If they don't, they're going to find it through drugs. And so that even plays, this is a whole nother topic, that even plays a role in our electronics. Okay. Electronics, all the makers are brilliant because electronics tap into our reward system.
Mm.
They tap into our dopamine area of our brain. So when our kids, they're excited by playing these games. So how do they get addicted? We are triggering that area of the brain of pleasure. Okay. So why would they not want to continue it? So as we progress from Atari to Nintendo to PlayStation to computer games,
Candy Crush.
Candy Crush, yes, right, right. You want that reward. You want that ding, right?
Mhm.
So now they've created games on computer that where you can't pause them. So
Mhm.
you could pause before, but it keeps them in it because if
Wow.
they stop, they can't get out of it.
Wow.
So it makes ADHD more difficult to treat because you're getting that stimulus all the time. It's making fun of
Mhm.
your teachers because teachers are going to be boring. They're not a video game. And so
Mm.
they're not tapping into that excitation. And so with that, that's why kids they can get into it so quickly and eventually, I think ADHD is going to be more diagnosed because we're causing them to want that to where they can't learn the way we are supposed to learn. Okay, we're
Tradition.
wanting yes, so we're wanting that true engagement electronically, and so but the ways of teaching hasn't changed, and so with that, you're also creating that issue that's there electronically that affects the ADHDers too.
All right. We got a couple of questions and comments. Brent said, "Can a particular diet help with treatment?" Great question, Brent.
Yes, yes.
Okay.
Yes, there are some, especially if you have one that's hypersensitive, that's very sensitive to certain preservatives in foods. Okay,
Mhm.
because there are some preservatives that kids are not knowingly somewhat allergic to. Okay,
Mhm.
and so when those things are exposed, sometimes they're I won't say toxic is a strong word, but it can be give you almost allergic reaction, not hives, but definitely kind of feeling stuffy or some
Mhm.
kind of reaction to those things. Now you don't know it. It's like dairy, for example.
Mhm.
Dairy can definitely kind of cause inflammation in the body.
Mhm.
So such things like that can cause more hyperactivity in some individuals. Red dye, for example, red dye can also cause some hyperactivity in individuals. So I have some people that avoid anything that has red dye in it. Um,
Mhm.
so it's also recognizing those changes. And if you implement that, okay, sometimes if you add that with some other health school, depending on the severity of the symptoms, can sometimes get you to where you might not need medication.
Wow. Wow, wow, wow. Great question, Brent, because I was kind of curious about that myself in terms of diet. Um, so a lot of preservatives, like you said, red dye, sometimes dairy, but you would have to, kind of test all of that, right? To
Yeah, so
see.
those are hard to find. There's some people that do testing like that. Um,
Mm-hmm.
and hard to find. And the reason it's hard to find because you got to battle insurance, but there are those that kind of do test for quote toxins, for lack of a better word,
Mm-hmm.
how the individual reacts to those. Okay,
Yeah.
and you'd be surprised when they detox the body, how they can react to once that's done. And sometimes when they get older, they grow out of it, but the reaction to those, but it's kind of like an inflammation to the body. If you
Mm-hmm.
think of steroids and how much we put of that in our foods, let's say if I take a steroid, some people become very hyper when they take steroids. So
Mm.
if we have a lot of steroids in our foods, it just kind of makes sense that it can possibly cause some, behavioral issues as well, depending on how much they eat long term.
Indeed. All right, Dr. Parks, he said, "I'm sure the good doctor has spoke on the topic. However, breaking up a child's day is a good strategy as well. Having a schedule so they can see it tangible, etc. Another example is, say you give a kid an ADHD with ADHD a sheet of math problems with about 30 problems, 3 or 4 at a time, break, then
Mhm.
come back to the next set, wash, rinse, repeat.
Yeah, yeah.
Yeah.
So
Okay.
that's coming down like spelling words instead of doing 20, kind of do 5 at a time.
Yeah.
Because they get overwhelmed for what they see, all
Mm,
right? And it's overstimulating. So that's kind of those skills that you add. You start early so that as they kind of middle school, high school, and on into work, those skills become habitual so that
yeah.
they learn to do those things for themselves naturally. Whether that be taking lists of reminders and those type of things, but that's something they can take with them on as you start, or the earlier you start it, the better, because then they can implement that into their normal study routine or what have you.
So I'm gonna tell you, this is causing me to think about the first grade class that I volunteer with a whole lot differently. Um, some of the things that you have described, I have witnessed in the class, and so I probably was thinking like these are some bad children, and maybe not so much. So I'm just curious from an education standpoint, like you have a teacher that, especially like elementary school, that has like 20 children in the class and all of these different little personalities and different things going on. So, are there any accommodations maybe given to children, I guess, that have been tested and have been diagnosed?
Yeah, so once you have the diagnosis, there's a 504 plan or the IEP, which is the Individualized Education Plan. And
Mm-hmm.
so with that, depending what the school proves, because a parent usually has to meet with the school officials and kind of go through that process. And so with that, they can get accommodations that may include special seating, extra time on test, having breaks. Sometimes they may need little occupational therapy because of handwriting. You may be able to implement that in the school, whatever the school is able to do, and willing, because sometimes they want to fight you on getting those things put in place. But also to decrease the stigma, because they used to do it where they pull you out. They don't pull you out as much like that anymore, so
Mm-hmm.
that you're not, you know, being kind of isolated or singled out. So usually they may have someone in the classroom. They call it inclusion,
Mm-hmm.
have someone in the classroom that kind of helps those individuals, but is one to help others, but make sure they're focused on them, make sure that they know what their assignments are, they're turning them in to kind of help teach those good habits of academics.
Mm-hmm.
In addition to, I think, embracing it as a teacher, okay, and normalizing it. Sometimes you get accommodations like a wheelchair. You can have approval where you can sit you can put tape around the chair and you can not necessarily stay in the seat, but you can maybe sit by your desk. Have that for everybody,
Yeah.
so that if that kid has that accommodation, it's not just that one kid, because every kid gets where they want to stand and kind of get stiff. Um,
Mm-hmm.
so those little things, if they make noise with their chair, teachers put tennis balls at the bottom so that they don't kind of make noise because they're scooting all over the place. Um,
Mm-hmm.
give them jobs in the classroom so they have that break to kind of go sharpen the pencils or whatever. So normalize it and put things in place that is for everybody. But
Mm-hmm.
the ADHD kids are there, but they're not singled out,
Right.
to where they don't feel like they can't ask questions or whatever
Mm-hmm.
the situation may be. And that helps decrease the stigma. If you do it for most, okay, or do it for all, then you really don't know which ones really need it. Okay, but you're also still teaching good habits regardless of who it's for.
No, that's really, really good. My sister is an educator. She said many of my students with ADHD have to take a lot of breaks.
Mm-hmm.
All right. Jennifer, communication between the parents and teachers is essential.
Mm-hmm.
Indeed. Thank you. And then Kelly, agenda mates in school help so much to remember homework.
Yes.
Okay.
My pet peeve with that is schools, they stop it after fifth grade.
I never even heard of that. What is that?
So it's like where you have an agenda and the kid kind of can write their homework down and the parent signs it. The parent gets to see, in early stages, the parent sees what the homework is, sign
Mm-hmm.
it. So then when it's done, so when it goes back to the teacher signs it once it's turned in and knows it's completed. So it teaches the kid to have a double check system.
Okay.
Hopefully as they get older, they become the parent and they become the teacher with that double check.
Mm-hmm.
Take it away, they stop doing it like fifth grade. And so
Gotcha.
right when middle school starts. And so it's a good thing. I wish they would do it longer. because and provide it because you stop the expectation, and they
Yeah.
don't have to have the teacher sign it, okay, but at least have some people, some schools do it where a peer has to sign that everything's there, um,
Mhm.
and it takes the teacher out of it. So they do different things that kind of are age appropriate, but so that that skill was going through high school. So
Indeed.
just writing it down, doing checklists, and making sure what you've got completed and is turned in.
Okay. We got Sabrina Zimmerman who said, hey, he's checking in. And then Bambi said, great info session. And then Kelly said earlier, thank you, Bambi. Kelly said earlier, sports helps so much. Can you share, talk a little bit about that?
Yeah, well, sports, because especially you're tapping into that when you run, you tap into that, you get that euphoric high when you're kind of doing a lot of exercise.
Mm-hmm.
So with that, your adrenaline goes up with competition. So you tap into it. So you tap into it chemically, but you also tap into it and physically because your body hurts, right? So you're
Mm-hmm.
tapping into it chemically, but you also tapping into it because the more individual is active in something, um, they do better with time management. The more time they have, the more they waste because they convince themselves that they have enough time to finish it, and then it's still the last minute. So all my ADHD kids tend to do better when they have a sport because they have that activity afterwards. After school, it gives them a break. Okay, it gives them a mental break and a physical break before they have to come back and possibly do some homework. But it narrows the time that they can waste after school. It keeps them off electronics. Okay, all
Mm-hmm.
right, but it narrows that time that they have to waste and do nothing and wait to the last minute. So it
Gotcha.
also helps with, and it doesn't have to be sports. It could be band. It could be anything, but some kind of activity of some sort after school that's not that is stimulating the brain in a different way.
Okay. Aunt, let's see, Dr. Sims, Aunt Daphne is listening from Austin, Texas. Very informative. My niece is awesome and an expert in her field. Yes, she is. All right. Marlene said, where did this prevalence come from? I don't remember this being as prevalent when we were in school, or was it just not diagnosed?
They wasn't diagnosed.
Okay. Because
They
Marlene is
were
my
they
age.
they were more considered to be bad. Okay, because the La La Landers weren't noticed. Okay, they just weren't getting it, and then the ones that were acting out and hyper, they were acting out and hyper. So it was a bit more of a behavioral thing than that. There's something else going on. Now, don't get me wrong. There are those that act out. That doesn't mean they have ADHD.
Mm-hmm.
But there was missed because back then it was a taboo, and something was wrong with you if you had it, because the ones that were labeled with it, so to speak, were the ones that had the behavior that was noticeable, and kids were going home and talking to their parents about it and stuff like that, like, oh, don't hang out with them. So those type of things were going on, and it was went more towards behavior that there may rather than there may be an issue.
Indeed. All right. Austin definitely can apply the token economy and task checklist into my classroom. Wonderful. Kathy Hughes Smith, is there a genetic component to this? Is a child or someone with ADHD more prone to this as well? And if so, is there anything that can be done as the parent of a child to help navigate before medication is necessary?
Yes, there is a genetic component. It's common that you'll have a child and the parent will have it as well.
Mm,
However, you got to think of where the parent's age may be. So, where the parent's age possibly is maybe in a time where it wasn't diagnosed that often. So, it's usually the parent has gone and is not been diagnosed or treated.
gotcha.
And so, but then when you start talking about the symptoms, the parent's like, oh, this kind of sounds familiar. And so,
Mhm.
so then you kind of like, they may say, well, I did that, or I had that issue in school. And so those type of things came out. It just wasn't as diagnosed when we were younger. So
Mhm.
we start recognizing those symptoms in ourselves when our kids are diagnosed.
Gotcha.
And then this other part of her question, which I hope that
Is there anything that can be done as a parent of a child to help navigate before medication is necessary?
yes, catching it early, okay, and not being in denial. Because when you're in denial, then they don't do anything. But if you catch it and kind of like the early elementary age stages, they can do such things that implement it in the classroom to kind of help with focus. They also can do things like we talked about, the token system and various things within the home to teach time management, organization, making sure you do one task request rather than multitask requests. Um, and doing those things in just different areas of life. Get them active in some kind of physical activity, because
Mhm.
that's natural stimulation of the pleasure center of your brain. And
Yeah.
so you do those things, and it requires attention. So if you do an activity, you get different instruction from a different person that's not your parent. You
Right.
have to have different instructions. So you are triggering that area of the brain, but you're triggering adrenaline during the activity. So
Mhm.
you are medicating without medicating with medication because you're of the activity that you possibly got your child in. So um,
Mhm.
and they have to learn that within a lot of noise, okay, like if you're playing football, it's a lot of stimulus, but you
Mm.
have to stay focused on your piece of the pie. And so it makes them have to do that. And so and it's you're giving them skills without realizing you're giving them skills.
Good, great comment. Jennifer, parent-child therapy is helpful to make sure everyone is on the same page and skills can be taught to everyone, and you will see better symptom management. All right, thank you for sharing that.
And that's
Yeah.
known as PCIT. So there is a therapy where they have a therapist, and the therapist can basically help the parent while they're with their kid, okay,
Hmm.
to guide them in parenting, especially if there's a major parenting issue.
PCIP.
PCIT, parent child interaction therapy.
Okay, I'm not familiar with that one. I have to look that one up. Okay, thank you for that, Jennifer. All right, Mr. Ernest Reed is on. Thank you for being here. He said, understand that ADHD is critical in understanding and meeting the needs of children and youth, even in the church. Yes, most youth volunteers are uninformed. Great information, Doc. So we are winding up our time, but just quickly, and Sherelle's got a question too. I'm gonna let her. We're gonna put hers up as well, but um, have you seen, youth workers of not only in the church? I mean, that's an important place as well, but like maybe with after school programs or anything like that that have utilized some training to, assist with uh, children that may have been that may be diagnosed with ADHD, since they are dealing with children, in these different places and spaces.
Not just kind of specific to one diagnosis, but you do see it popping up with things that they're trying to do after school. Um,
Mm-hmm.
whether it be social stuff, whether it be to homework, because homework's a big deal.
Yeah.
Um, because by then your medicine's worn off. Okay.
Mhm.
So by the time the parent gets them, the medication's worn off and they don't want to do their stuff at home. And then you got electronics and stuff that are in the home and a distraction. So any kind of program where they can kind of go to school, have some physical activity before or after school, and then go into where they can do homework before they get home. Um,
Mhm.
I think is extremely beneficial because then it lets home be home. Um,
Mhm.
and medication wise, I know it's worn out, so I know they don't have the benefit of that.
Okay.
And so the parents are yelling at them, and they're trying to get it done, and it just becomes an intense back and forth relationship with the parent, and can be very difficult and straining on in some depending on the severity, but it can really be straining on the relationship. And so that would help. And some schools implement that naturally.
Mhm.
Not all, but there's some that I see it pops up. I don't know if that's the reason, but it does help when you can have some those type of programs locally to kind of help in those situations. It's
Absolutely.
just making sure that when they're in those situations, the people that are doing those programs really kind of make sure the kids are getting on doing the work. Okay. No
Indeed.
phones, no none of that type of stuff.
Indeed. All right. Sherelle, thank you for being here. She said, why are there so many African American boys diagnosed with ADHD? Is it environmental?
Not necessarily environmental. I think that um, just behaviorally, it's just one of the first things that kind of doctors kind of stamp with. But mostly it comes oppositional. ODD usually comes first, okay, and then ADHD comes second hand. So, um, and I think that's kind of we ODD is there, and then I think then they go to the ADHD
Mm.
because that's kind of the first behavioral thing that they think of, that it's behavior and that it's not a diagnosis.
Mm.
But African Americans are, about 12%, compared to Caucasians are 10, and Hispanics are 8%,
Mm.
and
Okay.
Asians are 3%.
Interesting. All right. Treva said a lot of sports coaches are uninformed as well. Yeah, I thought about them as well. And then, okay, last question. Jennifer said, can kids who are diagnosed with and treated for ADHD grow up to be successful adults?
Yes, but as long as the parents gain insight, okay, because the parents are the guiders, right? And if they're in denial, then the skills necessary for that individual may come like therapy, and if they need medicine, that the medication and compliant, because when the medicine helps them learn the skills and keep the skills, and because then you can solidify it and make it habitual. And so with that, those skills can be taken into the future, okay. And I'm one myself. I was missed, okay. So I remember sitting in medical school and hearing all the diagnoses, like, oh, that sounds like me. But you do that with every diagnosis in medical school, okay? And so, and as time progressed, I learned certain things about it. I was one that would read, and I'd have to read it over and over, and to really kind of like, okay, I didn't even know what words I was reading, right? And so those some of the questions I ask is because that's kind of what I experienced, and I would study 5 hours, and my friends would study one. But it all depends on, that work ethic that you put into it as well. Cause some, like, I'm not doing it. I ain't studying 5 hours. So I'm not gonna do the extra that's involved. So it's that personality type that also depends on which direction it goes. And when I got out of residency, okay, out of residency, the doctor that hired me was like, "Have you ever been tested for ADHD?" And I was like, "No." She said, "Girl, well, you got it." Okay. So
Oh, wow.
yes. And so it is possible. It is harder. Okay. But you got to recognize, of course, I had no idea, but but I had things around me I had a small school. It was very structured. It was Catholic. I'm not Catholic, but it was Catholic. It was with nuns. They were very strict.
Yeah.
And so with that, it was a school for ADHDers because I had a high school class. My graduating class was 18. All right.
Oh, okay.
So it was, if you had it, you were able to do it because it was already manufactured for that type of environment. And so, but it instilled me those study skills that were necessary. So you can do that. It's just kind of recognizing our schools are big. So it's putting in place stuff like that to kind of help them in that arena.
Absolutely. Absolutely. All right. Very good. Well, this has been a great conversation. We are a little bit over an hour.
Yeah.
The time went fast, didn't it, Dr. Simms?
It did.
See? All right. So I'm going to give you an opportunity to give any closing remarks and tell folks how they can connect with you.
Okay. Just remember to be open-minded and not closed-minded, and allow the stigma to kind of overcome. We've really got to get past the stuff that's kind of been before us and realize that our kids do have issues. And if we don't help our kids with their issues, they're going to be adults with issues. And then more adults with issues, they have more say-so and they can resist and not seek treatment. Whereas kids, we can influence and we can encourage and we can kind of help them be in that right mindset to embrace their mental health as a priority. We embrace their physical health, so we also have to make sure that they embrace their mental health as well. Because if they're not mentally healthy, they can't stay physically healthy. So I do work in Chattanooga. My office is Comprehensive Psychiatric Care. The office number is 423-708-8670. The office email is office-assistant@cpc7161.com. So there could be questions, and I can kind of refer and give you suggestions and kind of what to look for if that's necessary. Can't necessarily give you medication advice on the phone because of liability reasons, but could at least maybe give advice of where you could go and what type of services to seek out.
Wonderful. Thank you so much. This was awesome.
Thank you.
I
Thanks for having me.
learned so much. I got a whole page full of notes here. And so I want to thank the viewers, the comments, the guests. For those of you who, again, are new to the platform, I invite you to subscribe to the Conversations with Nicole YouTube channel. We are here on Mondays and Wednesdays at 8:30 p.m. Eastern Time, focused on mental health and wellness, especially in Black and Brown communities. But we also have just other guests on that talk about mindset and wellness just on a regular basis. And so I am, again, just my wheels are turning, and I'm thinking about my class that I'm going to go visit tomorrow. And I'm going to look at my children from a different lens now that I have talked to Dr. Sims. I want to thank my cousin, Pastor Ernest Reed, and his lovely wife, my cousin in love, Sherelle Reed. Thank you both for being on here. Thank you for introducing me to Dr. Sims. And folks are chiming in. Let's keep this conversation going. I see you, Bambi. She said this was awesome. Thank you both for sharing. Shanita, thank you both. Brent, amazing, so caring and professional. Sherelle, thank you. You're welcome. Brooke, so much good information for parents, teachers, and anyone who interacts with children. Agree, Brooke. Thank you for sharing. Anitra, so glad to have met you, Dr. Sims. You are truly amazing indeed. Johnny Johnson, very informative. Thank you for being here, Johnny. Chandra Hanukkah, your sister is watching, and I'm proud of you. Love it. Love the family support. Yes. Kathy Hughes Smith, this has been very extremely informative. Thank you, Dr. Sims. Yes. All right. In Austin, thank you so much, Dr. Sims, for the information. My mom said wonderful. Thank you, Mom, for being here. And then Laura Reimer Brown, Dr. Sims is the best indeed. I concur. Oh my goodness. So thank you all. Let's keep this conversation going. Please share this with someone who you think can benefit from it. And I think we might have to have Dr. Sims back if she can fit us in her
Yeah,
schedule.
I'd love to. It was awesome. It was awesome.
Okay. Wonderful, wonderful, wonderful. Well, good people, you all have a great rest of the evening, and we will see you next time.
Bye
Bye.
bye.